Hi everybody, this is Tony with some information about how to develop your standardized patient case. What you'll get from me are two files, one being the case template that you will complete and another one showing the template with directions. And so I'm going to go over the template that shows the directions on how to fill this out. So the first page includes case author directions, in which I'm just giving you some general information about how to fill out the case template. When you're done with your case, just send it to me at my Drexel email address. And the one thing that you want to do, you'll see at the top, is case name. You'll want to name your case for your patient's name. So if you're developing a case for a patient named John Smith, that becomes the patient's case name. And also you want to be sure that you fill in the submitted by with your name there, so I know exactly who's writing the case. And what you're going to be doing is writing a case for a second year preclinical medical nursing or pharmacy student. And I'll give you some information about how to complete this, but you'll assume that the student can take a basic medical history, and for that you want to refer to the history taking guide that I will upload to Blackboard in the handout section. So basically this is a student who preclinical, perhaps have had very little experience with actual patients or no patient experience, but perhaps have had some standardized patient experience. So pretty basic stuff here. The next page shows the case information. This is useful in organizing your case for educational purposes. So the first part is I'm going to ask you to decide what is your patient's presentation. Are you developing a case for an acute problem, a chronic problem, or a health promotion and disease prevention problem? And that would include any, for example, a patient who's coming in for a statin renewal, but yet their lifestyle is pretty appalling. They're doing all the things that they shouldn't be doing because the statin is keeping their cholesterol under control. But we'll get into those issues later when we get to actually developing the case. So choose one of these, either acute, chronic, or health promotion or disease prevention case. The other thing is to check off what kind of complaint is the patient coming in with. Is it a cardiovascular, gastrointestinal, respiratory, neurologic, genitourinary, musculoskeletal? Feel free to add another kind of complaint that you might want to come up with, but focus on the system and the issue that the patient will be presenting with. The other thing to write in is differential diagnosis, in which you would list 3 possible diagnoses. Often the SP cases are written without one specific diagnosis in mind, so that the student really has to make some decisions and base their treatment, if that's what required in the case, based on their top choice of diagnosis. But if you're not sure what diagnosis to write in, just leave this blank for now, and we can get to that later. All of you will be writing a case that's appropriate for an ambulatory clinic. So assume that the patient is being seen in an outpatient clinic. However, you could change this, I suppose, if you want to write something. For those of you in emergency medicine, where you're interviewing, you're taking a history on a patient who's in an ER, and so if you'd like to change that, that would be fine. But it's okay with me if you write a case just for ambulatory care, something not too complicated. The other part of the first page has to do with SP case demographics, their hiring information. I will fill in the age and gender for you. I have a limited number of SPs that we'll be using, and so therefore I will assign a standardized patient to you with a specific age and gender. But one thing that you might want to write in is what's called SP inclusion and exclusion criteria. So you might want to be very specific about what special characteristics should the standardized patient playing the case should have. And here, it might be necessary to, consider the person's body mass index. So, for example, if you're portraying a patient or you're writing a case for a patient who is overweight, has a heart condition, and emergent diabetes, then you want to hire somebody that's, that appropriate, body mass index. Exclusion criteria includes the physical findings that the actual patient playing the case should not have. So, for example, if someone is playing a case with chest pain, you want to make sure that the actual person playing the case didn't have, for example, open heart surgery. That would really be a source of confusion for the learner. So just write in what the patient should have, if anything, and certainly what they should not have, what kind of actual physical findings that person playing the case should not have in order to avoid confusion. The other issue, too, is remember you want to write a case for a second-year medical student. A little typo here. I really mean second-year medical, nursing, pharmacy student. Preclinical, again, none to minimal patient contact. Imagine that you're using this for teaching. What are the goals of this SP encounter in general terms? What are your objectives? What are the expected behaviors? This case will be written for history taking only, not a physical exam, because you're going to be interviewing a standardized patient by Skype, therefore no physical exam. Of course, you can be asking about the patient's physical condition, but won't have the opportunity to examine them, so therefore the objective should not be being able to take a competent physical examination. And also, how do you want to challenge the learners? So you might want to give some consideration to this. If you're writing a case about a patient who's not taking care of himself and is reluctant to see a doctor and has some behavioral issues, you might want to write that in, that the challenge to the learner is to interview a resistant patient. The next page includes just a general description of the patient, in which you want to write a short paragraph summarizing for the reason for the visit. Because the standardized patient case is primarily used to train the standardized patient, you want to give them kind of a thumbnail overview of the case. I would suggest writing the patient in the second person, that is, to the standardized patient you're training and not about the patient. So, for example, I just have some suggested verbiage. You are a 45-year-old female complaining of chronic headaches, etc. And just a short paragraph will do. Again, just a thumbnail. And then you might want to also describe his or her mood and demeanor. What is the patient's emotional state at the time of the exam? Are they anxious, scared, impatient, because they've been kept waiting, and so forth? Just write some general directions here, which will be expanded upon as we go forward in this case. One thing that is optional, but I highly suggest for adult learners, is to include graphics to help them grasp what the case is at a glance. As you know, there are different learning styles. Some people learn by reading text, others are very visual learners, others are auditory, and in the best cases, include all three of those things in the case itself. It appeals to different types of learners. So I just found this on the internet. I think I wrote in chronic headaches and a bunch of images popped up, so you can put that on the first page of your case just to show the patient what kind of patient they're going to be playing. And I did this because once when I was working with an SP, she came to work one afternoon and was completely confused, could not remember, was looking at the case notes that were all text-based at that time, and she couldn't focus because she was overwhelmed because she had played another case in the morning and two other cases the day before, two other schools. So I just learned that maybe the best way to get people focused quickly is to show them what they're going to be playing. Another thing that is optional, but you can also include links to websites that will help the SP understand the issues. And often the better SPs do their own separate homework and try to find out something about the case that they're playing. I think it's a good idea to vet these websites for them so that they're not misled. They're going to do it anyway, so you might as well do it for them. And so for example, I like to use the Mayo Clinic. It's a good layperson's website to understand some basic information about some issues. Also, YouTube has a lot of videos on different kinds of issues. So if it was concussion, there's a YouTube on mild traumatic brain injury. And again, this educates the standardized patients into the type of case they're going to be playing. It's really a way of engaging them in the learning process. Now the next page gets into the nitty-gritty of the case itself, and you'll notice that it's set up in a Q&A format. And the reason to do this is you want to give SPs answers to the most common questions that are going to be asked, and it's sometimes important to also include some of the questions that may not be relevant necessarily to the case but may get asked anyway. One of the reasons why you want to suggest the questions and give the correct response is knowing the answers to the questions reduces the possibility that the SPs will give the wrong information. Also, it's a performance fidelity issue. If it looks like the SP is making something up on the spot because they didn't have the information, it just looks more fake than it really is. Let's face it, this is a simulation. Everyone knows it, but it's important to not distract the learner and highlight the fact that this is indeed a simulation. You want to keep it as real as possible. And also, if you're writing history checklists, which we will get into at a later time, SPs tend to remember information they gave versus what question got asked, because questions can be asked in 10 or 20 different ways. And at the end of the encounter, when the SP has to fill out a history checklist, if there is one, they're more prone to remember what they said versus what got asked. So what I'm giving you here is a series of questions, and then you will fill in the response under the bullet point. What brings you in today? What would be the answer to that question based on your patient? Tell me more about that. What would be that response that the patient would give? In the template, I'm giving you pretty generic questions, but feel free to add symptom-related questions that are relevant to the case that you're developing. And if the questions don't pertain to your case, just leave the answer blank, but don't delete it, because you may want to come back and change that later, because case development is an iterative process. And I'll go over the issues in case development and how they're developed in the lecture, but for now, just read the question, fill in the answer, feel free to edit the question and fill in the proper answer. And it moves forward. Again, I put the graphics in to help orient the SP when they're being trained to what to look for, what type of question are they looking for. It helps them to stimulate their memory by giving them various cues. So issues such as timing, onset, the quality of the pain, what does it feel like, describe the problem, the severity in their own words, or severity, pain severity on a 1 to 10 pain scale, region and radiation, where does the pain bother you, does the pain move anywhere, palliation, what makes the pain or problem better, or provocative, what makes it worse. These are very common questions that most medical students have been trained to answer. Moving on here, recent weight gain or weight loss may be relevant. Changes in bowel and urinary habits. Again, feel free to add questions as appropriate, but you'll also then have to supply an answer in the bullet point for the standardized patient. And finally, what are the pertinent negatives that might get asked? No problems with, X, Y, or Z. Spell that out. Health history. How would the patient answer this question? What's your past medical history like? What kinds of problems have you had in the past? Note that under the bullet point. Vitamins and supplements, vaccinations, screenings, allergies to medication, food, substances, animals, etc. This could be 4 separate questions. Any surgeries, female and male health issues, and significant family medical history. Be as specific as possible. If the parents have had significant medical problems and perhaps have passed on, just be clear exactly what it is, exactly that is. Okay. Who the parents are, when they died, what did they die of, and so forth. Now, under social history, this is often important if you want to put the patient in the context of their life. What education has the patient had? Are they, for example, just high school graduates or college graduates? This will help the patient to understand, how sophisticated they should be, perhaps in their responses, and you would give that patient directions. What's their occupation? What are their community characteristics? This might be relevant, for example, if the patient is having health problems. Is it related to that landfill that they're living next to, or the mold that's growing in their bedroom? These are important questions that need to get asked, for example, in a respiratory case. What social supports does the patient have? What is their marriage or their partnership like, if they have one? Do they have children and grandchildren? It's important that you, I think, name the children in case somebody asks, what are your kids' names? You don't want them to make this thing up on the spot. Names and ages are important. Give the patient an actual life. It may not be relevant at all to the case, but again, you want to just ensure that the patient has sufficient information about their character, that they won't appear to be making things up on the spot. Health promotion and health risk factors are important. Diet, exercise, caffeine, alcohol use, tobacco use. Feel free to modify these questions with information. With questions like tobacco use, you may need to ask a lot of questions. Do you smoke cigarettes? How long have you smoked cigarettes? Have you tried to quit? What have you tried? Those kinds of things. If it's relevant to the case, especially, you want to have more detailed answers. So you want to have good answers to good questions, and not leave it up to the standardized patient to improvise. Recreational substance abuse, internet use, I think, is especially relevant for teenagers who are up all night texting and doing whatever on their smartphones could affect their sleep habits. And stressors. How do you cope with, what kind of stressors do you have? How do you cope with stressors, and so forth? These are relevant questions to understand the whole patient. There's another page on general SP directions. Depending upon your case, these could be altered, but for this exercise, I would just assume that the patient that you're seeing is in an exam gown and so forth. But you're going to see them on Skype. They're not going to be in a gown. You're going to be talking to them one-on-one, but imagine that they are in an exam gown and, seated on an exam table when the exam starts, as they would in a regular ambulatory care clinic. It's also possible, I suppose, that they could not be in a gown. They could be, dressed. And when I see my doctor, first I see him in his office fully clothed, and then we move to the exam room, and then I put the exam gown on. So you could play with that a little bit. What's the speech and demeanor and body language of the patient? Is their speech normal? Is it pressured? Is it what's their demeanor? That is, their outward behavior, their body language, conscious or unconscious gestures or movements. If they're in pain, we'll get into simulating the symptoms later, but that may be relevant to this part. What is their knowledge or understanding of the problem? What does the patient know or believe about the problem, whether it's accurate or distorted or delusional? I was once, when I was a therapist, I treated a family who all came in complaining of headaches. They thought the lady down the street didn't like them and gave them the evil eye. This was an Italian family, very traditional, from South Philadelphia, and turned out they actually had a gas leak in their house. So, but it's important to sometimes understand, if asked, what do you think is going on? And having a answer, I think, might be helpful. What you want from the exam? Do you want medication? Do you want oxycodone? Do you want a note from the doctor so that you can take a day off from work? Write in what the patient wants from this encounter. And also the standardized patient probe, which is a challenging question that the SP will ask the learner. Doctor, what do you think is going on? Or do you think I have cancer? Or, my mother died of this problem. I'm afraid I've got breast cancer like hers. What do you think? So you might want to write in a question that will challenge at some point the learner to answer that question and specify when that question would be asked. Finally, simulating the symptoms. How will the SP portray the symptoms, and which would be consistent with the character they're portraying? Is he or she in pain, and where is the pain located? So I think I'd like to, again, use graphics to also complement any description, any written description of the problems. It helps the patient to understand exactly how to answer the question. So, for example, here's just an illustration of where the pain hurts, and you could write in some additional information about what would happen if they were palpated. Although, again, there won't be any physical examination, but at least helps the patient to envision where the problem is, how far it spreads, and so forth. If you were writing a musculoskeletal case, you could find a graphic, as I found here, that might indicate how far the patient could, side bend their head. What would be the limit of their range of motion? So illustrating it is sometimes preferable to writing it out. Again, appealing to their different learning methods really helps the SP to get the case and be able to replicate it accurately and consistently over the course of time. If you have any questions about writing your case, please contact me. I'll be glad to get back to you quickly with your answers. We can have a conversation. I can answer you by email, but I look forward to reading your cases. And we'll be talking about this soon. Thanks.